Excellencies, distinguished representatives of the esteemed organizations, ladies and gentlemen, welcome to this side event on wastewater surveillance for public health monitoring using the One Health approach to meeting the SDGs held as part of the United Nations Water Conference. This event is organized in the lead of the Ministry of Health of Turkey with the great support of many esteemed partner organizations from around the world. The event will start with an opening session followed by interactive discussions on wastewater surveillance. Without further ado, as the first speaker in the opening session, I would like to invite Dr. Bekir Keskin-Kılıç, Deputy Director General of Public Health of Ministry of Health of Turkey. Dr. Keskin-Kılıç, please, you have the floor.
Honorable Minister, distinguished participants, ladies and gentlemen. It is a great pleasure for me to welcome you to this important event, organized together with respectable organizations from different parts of the world and hosted here in beautiful Turkish house. As you all remember clearly, following the announcement of the novel coronavirus infection as a pandemic by the World Health Organization in March 2020, all aspects of our lifestyles have been affected in a way that we had never experienced before. Since it's not enough to take any protective measures to stop spreading of the virus, countries were in a race to detect infected persons, to isolate and treat them. Due to high cost and challenging logistics, it has been impossible to test all individuals who may be carrying the virus without presenting any symptoms. In this concept, wastewater surveillance studies have received great interest again during the pandemic, reveal the prevalence and trends of infection in the community, and serve as an effective early warning tool for public health decision makers. Thanks to this approach, early warning signs of an upcoming surge of cases can be detected at least 4 or 5 days in advance. The experiences gained from wastewater-based epidemiologic studies may ensure critical time to react against any possible future pandemics or at least epidemics. In addition to these studies have promising potentials to be used in tracking viruses and pathogens, as well as antibiotic resistance, which is the silent pandemic of our era. As the Ministry of Health of Turkey, we have very recently been involved in wastewater surveillance by implementing the digitalization of nationwide wastewater surveillance activities into public health monitoring for early warning and response structure. Also, we have attempts to integrate this 2 years experience to monitor possible infectious diseases for thousands of people living in temporary settlements after the massive earthquake we experienced in the last month in southeastern part of my country. We are very much pleased to organize this side event with our respectable partners, distinguished representatives from centers of communicable diseases, health initiatives, policymakers, water associations, UN organizations, and governments with active role in sewage surveillance and health policy. We hope that all these efforts will lead to a systematic methodology and solid network that will be highly beneficial in protecting human life in the future within the One Health approach that aims to development of global health security. I appreciate your kind interest and participation, and I'm looking forward to discussions in the panel. Thank you very much.
We thank Dr. Keskin-Kılıç for his speech on the leave of the Turkish Ministry of Health. As the next speaker, I'd like to call Mrs. Anna Burgos, Policy Officer in the European Health Emergency Preparedness and Response Authority, for her opening remarks. Mrs. Burgos, please, you have the floor.
Your Excellency, dear colleagues, I'm extremely happy and honored to be able to share with you the ideas and the work that the European Commission has been doing in the field of wastewater surveillance in the last years. So we have been hearing during the UN conference how difficult COVID-19 has been for many different areas in the world. But what we saw in Europe is that COVID-19 brought many people together in the fight and in the response to the crisis. So in this case, the public health authorities and the environmental authorities were brought together, and the Commission issued a recommendation to ensure monitoring of samples of SARS-CoV-2, and also created a community of practice and an IT system to be able to collect all the data around Europe. And for this, we committed 20 million in 2021, but we are still exploring possibilities and next steps. So in 2023, the European Commission has already committed around 20 million for a joint action with member states that will explore the sharing of experiences, but not only for SARS-CoV-2, but also beyond COVID-19 to explore and be better prepared for future emergencies. And we will explore for sure AMR, polio, and other areas of concern. And we want to open this to low and medium income countries, so we will start capacity building activities. And we are looking also beyond the data sharing at the European level, and we are looking to further explore the global cooperation for data sharing. Just to finalize, to say that wastewater surveillance is a high priority for the Commission, and we are very happy to hear in the panel what are the opinions of these experts and how we can move forward to explore and to increase global cooperation in this area. Thank you.
Thank you, Mrs. Bourbeaus, for your valuable points. Our next speaker will be Mr. Louis Fouchon, the President of the World Water Council. Mr. Fouchon, please, the floor is yours.
Minister, distinguished delegates, dear friends of water, I'm happy and honored to be with you today at the Turkish House. And on behalf of the World Water Council and myself, I'd like to thank the highest Turkish authorities and the Turkish Water Institute and its partners. This is a very important moment. For 4 years we have worked all together on this tragic issue, which is the COVID. And I would like to say before that the World Water Council and its 300 organizations, 60 governments, Turkish governments for the beginning, that's between us, Turkey and the Council, a trustful relationship. For around 15 years, a little bit more, after Istanbul Forum in 2009, we have collaborated and worked on the most critical issues facing the water world. More recently, we have worked together on water and health issues. It was the first time. And I would like to take this opportunity to publicly acknowledge and commend the tremendous and pioneering work accomplished by Ahmed Sachi, who was also governor of the World Water Council, and his team, his colleagues, on the pandemic. You want to know that the World Water Council and SUEN, the Turkish Water Institute, have launched the idea of a COVID-19 working group to deepen the study of the role of wastewater as a key early warning solution to better anticipate epidemic trends. The group, this task force, this group received well-deserved international attention, and several prestigious institutions progressively joined the innovative initiative. Their hard work significantly contributed to improve the detection of COVID-19 in water, in wastewater, and highlighted the close links between health and water. Because of its implications with many pandemic solutions, there's a growing interest in wastewater epidemiology and implementation of water surveillance. The Council with SUEN will continue working beyond COVID-19 and towards a broader approach with the water monitoring for health program. Dear friends of water, the pandemic was a brutal teacher. It has been a painful reminder of our failures as a global community when it comes to water and health issues. You know that COVID has caused around 6 million deaths. There's in front of us new threats, all kinds of pollutions, which are also linked with health. A very important survey published by the in English review, the Lancet, everybody knows the Lancet, I think, was explaining 4 months ago that we have yearly, every year, 8 to 9 million deaths from all kinds of pollutions: air pollution, water pollution, soil pollutions, oceans pollutions. That's in front of us, and we need also to work on this issue. And we have seen, and we will see, unfortunately, all pollutions and contaminations lead to tragedy. This is not acceptable in this century, and so these unprecedented times have shown that difficult decisions can be made, then budgets can be unlocked and mobilized when people's lives and economies were at stake. We did it for COVID. Why can't we do for water and whole water-linked illness? That's the reason we say, and we will say again and again, water is politics. We have quite all the technical solutions, the financial solutions, the institutional solutions. We have all we know, but now we need a strong political will to face these threats and to deliver the solution. Only a strong signal from the highest levels of decision making will lead to significant change, and it's the responsibility of the political leaders and some economic stakeholders. Hopefully this conference in the UN during these 3 days succeeded in relaying this message at the highest level. So our council, the World Water Council, will continue to take every opportunity to keep calling political leaders to act and create the enabling environments and encourage concrete and cross-cutting responses, and in the field of water, of health, obviously. So, dear friends, to conclude, we cannot keep looking at words. We need to look at actions and hold the responsible parties accountable. Next year, in May 2024, we will organize with our Indonesian colleagues the next World Water Forum. It will take place in Bali in May 2024. We need to go to Bali able to present concrete solutions and ground responses for the people at large. They are waiting the result of our work, they are waiting the result of our actions. So do it, help us, join us, and welcome to Bali next year. Thank you.
We thank Honorable President for his statement on World Water Council's view on wastewater surveillance. As the last speaker of the opening session, I am pleased to invite His Excellency Professor Vahit Kirişçi, Minister of Agriculture and Forestry of Turkey, to give the final opening remarks. Your Excellency, please, the floor is yours.
Dear representatives of distinguished organizations, colleagues, ladies and gentlemen, it is my great pleasure to welcome you to this important event and thank you for your participation. 3 years ago, in March 2020, with the announcement of the COVID-19 pandemic by the World Health Organization, a few countries have started to use wastewater surveillance for COVID-19 monitoring in the community. Under the lead of the Ministry of Agriculture and Forestry, Turkey is one of those countries that initiated a nationwide SARS-CoV-2 surveillance study in wastewaters. Although the wastewater-based epidemiology concept is not new, the importance of this practice has become better understood with the COVID-19 outbreak. Wastewater surveillance studies in this context reveal the prevalence and the trend of infection in the community and serve as a cost-effective early warning tool for public health decision makers. For 3 years, Turkey is continuing wastewater surveillance at 50-day intervals from 21 pilot cities and weekly in Istanbul. In this regard, 42% of the Turkey's population and 70% of Istanbul are screened weekly for COVID-19 spread. COVID-19 distribution maps of the country are shared at the Ministry webpage, both in English and Turkish. We are in close collaboration with countries undertaking these activities. Our project team have participated in various international events and published articles and reports to share and disseminate project findings globally. Fruitful collaborations achieved through these activities are the major basis of this side event, bringing us all together today. As Turkey, we are pleased to lead this side event together with the various important organizations from all around the world leading similar wastewater surveillance activities. We believe that these efforts will lead to the integration of similar works in public health monitoring for not only COVID-19, but also other pathogenic and viral disease, pollution, pollutants of emerging concerns, and antibiotic resistance bacteria, and any other public health parameters. We hope that this side event will be remembered in the future as one of the milestones for the global use of wastewater surveillance in public health monitoring. I thank all contributors and the participants again and hope this event to be a very fruitful one. Thank you very much.
We thank His Excellency for his kind speech. By this way, we have come to the end of the opening session, and I would like to hand over to Professor Bilge Kocamemi and Dr. Bernd Galvik, who will be co-moderating the panel discussion. But let me introduce our moderators first. Professor Bilge Kocamemi is the coordinator of nationwide Turkey COVID-19 wastewater surveillance project under Turkish Water Institute for 3 years. And Dr. Galvik is tasked to ensure technical support and overall coordination of the European Commission recommendation on wastewater-based surveillance of SARS-CoV-2 and its variants. Please, you have the floor.
Your Excellency, distinguished representatives of organizations, and ladies and gentlemen, welcome to the side event of wastewater surveillance for public health monitoring. After 3 years huge global efforts on wastewater surveillance used for COVID-19 tracking, I'm really glad to moderate this side event together with my colleague, Dr. Manfred Galvik. So with the declaration of the pandemic on March 2020, the use of wastewater surveillance was first started in the Netherlands, and we have the guest from the Netherlands who started these studies first, and then closely followed by various countries like Turkey, Australia, France, and Italy. And as the time passes, the number of the studies increase gradually, and as of today, there are 72 countries in the world performing wastewater surveillance for COVID-19 monitoring. And now, today, we are all here with our distinguished speakers from various organizations leading wastewater surveillance during the pandemic. And in this event, we are aiming to talk about past, present, and most importantly, future of wastewater surveillance activities for public health monitoring. And I would like to give floor to my colleague, Mr. Ben Gavlik, for the opening, and then we will continue with the session one. Yes.
Thank you. Your Excellency, distinguished guests, friends, it's a pleasure and honor to be here in New York, to have attended the UN Water Conference 2023, and it's an even greater pleasure to be hosted here today in the Turkish House. So on behalf also of the European Commission, we would like to thank the government of Turkey for having made this possible. Having said this, we have here an opportunity to go a step further, to make maybe the first step already after what's happening after the closure of the UN Water Conference, a step into the future in which we start to understand that water knows us. Water knows everything we do with it. Water is a mirror of society. But we still have to learn a lot from water, about water. And one of the keys in this is indeed that we look into the cultural connections, into connecting different fields of science which are not only genetics, chemistry, or civil engineering, but which equally include anthropology, or financing, and civil rights. I believe we have a very interesting panel today. I hope you enjoy what we expect to see, and I hope you will be with us in the journey which is about to start today. Thank you very much.
Thank you, Ben. So, in the first session, we will first discuss progress and successes of wastewater surveillance during COVID-19 pandemic, and then we will discuss the use of wastewater surveillance as a tool for public health decisions. I would like to invite our panelists for this session, Kate Medlicott from World Health Organization, Ricardo Denaro, Ricardo Denaro from United Nations Education Environment Program, Professor Gersham Medema from KWR, Professor Ahmet Mete Sarkis from Turkish Water Institute and World Water Council, Oliver Schmo from World Health Organization, Associated Professor Tarja Pitkanen from Finnish Institute for Health and Welfare, Dr. Jennifer Mawanta from WRC and LISA. Okay, please. Okay, we will start with the World Health Organization. You declared the pandemic to all of us, unfortunately. Okay, so the first question comes to the Kate Medlicott from World Health Organization. So, Kate, can you please summarize us the major added values of wastewater-based epidemiology or surveillance studies? You have to. One.
Sorry for the delay. So, it's working. Yeah, let's go. So firstly, to say, I think we're talking about this in the context of COVID-19, which would be easy for many people to think that this was a new tool, but in fact, environmental surveillance or wastewater-based epidemiology has been around for a long time. And most notably, I would say, in the work on polio, and it's become, even in this city in New York, wastewater-based surveillance has been instrumental in polio, and we can see the public health significance of doing that. And also in your illicit drugs, more recently with looking at cholera or antimicrobial resistance. I think the really key thing we need to be focusing on is how does this support the kind of public health decision making we need to be doing? Does this provide an additional line of information that's not available through existing surveillance systems? Or does it more cost effectively get to that information? And I think what we're seeing within WHO and over the course of the COVID-19 pandemic
that added value is suddenly, becoming a lot clearer, and I would say, 2 or 3 years ago, people at Wastewater were so absorbed in the immediate aspects of the pandemic, they didn't have a lot of time to be thinking about environmental surveillance. But now that the dust is settling a little bit and all of these amazing bits of research are coming out, people are saying, oh yeah, this is actually really interesting, not just for COVID-19, but for a whole suite of things. So I think one of the really important lessons is that we have to, make sure that public health use case is clear, and that those lines of coordination between the organisations doing the environmental surveillance and the users of that data within public health are clear. But sorry, to your question about what are the kind of uses, and I think it's shown itself to be useful for a whole lot of things and ways that are evolving as the outbreaks of pandemics advance. So we can use it for increasing or looking at increasing or decreasing trends. We can use it for detection of places that are thought to be pathogen free. We can use it to augment risk communications. We can use it for targeting specific kinds of other forms of surveillance, and of course we can look at it for detecting known and unknown variants. So there's a huge range of use cases, and I think we're at this moment of an upswing of trying to figure out how do we optimize these use cases for which pathogens and so forth. So I'll stop there.
Thank you, Kate. And great to have you here. It's also my pleasure to introduce the next speaker. Because of the microphone. Ricardo Zenabo from the UN Environment Programme. And I think it fits very nicely that we got the public health sector again next to the environmental sector. So here comes the question for you, Ricardo. How has surveillance, wastewater surveillance, helped to change the paradigm in public health monitoring around the role and importance of wastewater?
Good morning. Good morning. Okay, it's working. Good morning, everyone. First of all, thank you, Bernd, Vilge, and to all of us who were hosting this very good, important event. I think my answer will be very simple, Bernd. When I joined UNEP in 2018, I think the paradigm around wastewater was that this is a resource that we don't really pay enough attention about. And in many cases, we had to struggle quite a lot to say that wastewater is actually a very useful resource, and we are completely neglecting the opportunity that we have to recover useful materials, understand what are the trends in the environment and also for public health. So my job, I felt sometimes also a bit frustrated because this was not understood. And here comes the good news. If there is one thing that COVID, through the tragedy, taught us and brought us was more attention on wastewater and the opportunity to see how this is actually helpful for everyone, for public health and also for the environment. I think we have changed the paradigm, and we managed to put wastewater high on agendas. And is this enough? I don't think so, but we are getting there. We are getting there, and this is my main message today. We should definitely capitalize on what has been done so far through these programs, through these surveillance programs, and continue stronger in this direction. And this is a tool that, from the environmental perspective, is very, very useful to tackle, for instance, the planetary crisis that we have on climate change, on pollution, and on biodiversity. So I would say this is a positive message that I want to sort of convey. We're getting there, the paradigm is shifting, but we need, of course, to continue in this direction. Thanks.
Thank you, Ricardo. Before asking the next question, Gershon, please take the microphone in that way, okay, close to your mouth. Yes, our next speaker is Gershon Medema. Professor Gershon Medema is a very important person in the start of the wastewater surveillance studies, because we all started these studies with reading the preprint of the Gershon Medema. During these 3 years, we attended many webinars all together. And we discussed the molecular techniques, because the wastewater-based surveillance is really based on the molecular techniques, and most of you are not familiar with the molecular techniques. We know we are talking about qPCR, ddPCR, NGS, now the common words are what the multiplex PCR, hyperplex PCR. So Gersham, can you make a brief summary, easily understanding summary of those techniques? What are those techniques and for which purposes we are using this?
Okay, thank you, Bilge. Thank you also for the kind words. I think it was something waiting to happen. So we happen to be early in the Netherlands, but I think that it was disseminated so fast that you see that many researchers around the world were starting already very early on in the pandemic. And I think that we capitalized on the fact that in many places in the world there were people that were studying viruses in water. So we had methods to capture viruses from water sample and concentrate them and get their DNA or RNA out of it, and then put that in a PCR machine. And that was also very helpful because we used the clinical methods that was published, I think, for clinical surveillance of the nose swabs of COVID was published at the end of January, and already in February we were on the move in the wastewater. And this combination of, let's say, the environmental scientists that had the methods to look in the environment and clinical virology was very instrumental in the whole process. It was instrumental early on, but also later when we stumbled upon new variants of concern. We could use all the things that happened in clinical virology with method development for these. We could immediately sort of translate that into wastewater surveillance. So the link between the environmental virology and the clinical virology was really helpful in this process. And I think that will continue to be so. I will talk later about the future, but I think with the methods for the variants of concern, we started to move from the PCR type methods to the sequencing type methods, where we sequence all the DNA or RNA that is in the sample. And because we are so close to the clinical virology, you can relatively easily add on new methods for new viruses, or maybe even in this metavirome that is in the wastewater, observe new things that we cannot see through other means. So I think it was, well, we capitalized on the fact that we already had quite some environmental virologists, and a good combination between environmental and clinical virology that was really helpful, and will also help us move into the future to expand the surveillance program. Thank you.
So, Professor Saatchi, we've heard the word of science. Now we need the word of wisdom and engineering. So the question is coming for you. What are the main challenges identified in the integration of wastewater-based surveillance to the existing Sentinel surveillance system? Kathleen mentioned the clinical area, so we come now with something new. What do you think are the main challenges here?
Well, we have many challenges.
Yeah.
I have to swallow it. I was in the United Nations Interactive Dialogue yesterday, and the topic was cross-sectoral cooperation. So the whole process in Turkey was a real cooperation between different stakeholders. So I will briefly explain that. It all started when I read Madema's paper, right at the beginning of the COVID, I think. It's better now, okay, it has to be closer. And I was really impressed by it. I said, why don't we try that? And I sent the paper to the Ministry of Agriculture and Foreign Ministry. And we had two laboratories. One was a very old one in Istanbul during the Pasteur times. And we had a similar laboratory in Ankara. So we started to imitate his results. He was using, I think, very specific filters for that purpose. So we looked for the filters, and we could purchase them, and I have to thank State Hydraulic Works for it, because we paid a lot of money for that. We tried and we failed. We couldn't reproduce the results. Then after lots of research, we found that a very simple chemical, polyethylene PEG, PEG, can do the same thing by precipitating, etc. And there, Bilge entered into picture. She's like a diesel engine, and she started processing the whole thing. At last, we succeeded. We tried to get results, and we needed a molecular biologist to interpret the results, and we found it. That's a long story. So we had a cooperation between the ministry and the parts of the ministry where we got the money, etc., and the university. So we had a multilateral cooperation. Now, doing this, then our next question was, how do we do it for the whole Turkey, 85 million people? How do we disseminate the tests and the results? So again, we use State Hydraulic Works for it, thanks again, because they have all the facilities. They have directorates in almost every city. They have transportation system. And we had to do a little bit of capacity training, how to get the samples from the wastewater treatment plants and how to have the cold chain at 40 degrees. But the wastewater treatment plants and the sewer systems, they belong to municipalities. And municipalities are totally independent. We have 30 metropolitan municipalities, and their population is greater than 750,000. And they constitute about 78% of the population. So we approached them, but we were a little bit hesitant because they belong to different political groups. But they all agreed to cooperate with us. They bought their own sampling bottles and they helped in the transportation as well. So under pressure, the silos, they disappeared.
True, huh? Absolutely, yeah.
Then we met the GRC and the town hall meetings. So we have the results, but then how do we present the results was the next topic. We learned about the dashboards, and we attended your town hall meetings, and we met all this, esteemed group here. That we learned a lot from them. Then we started to draw the maps, but the Ministry of Health was using the red color. We used green, shades of green all over Turkey, and we could prepare the maps, and then we could show them in the ministry website, and that was the whole story. If I summarize it briefly. Thank you very much.
Thank you. Moshe has to leave. The burden of command. Burden of command, Oliver. So I open the second session now. We have heard a very nice introduction, Kate. It started from WHO perspective. But at the end, what we are talking about here today is actually very much in the title of the session number 2, which is wastewater surveillance as a tool to support public health decisions. And Oliver, you have been, certainly for me, together with Kate, the reference point in the World Health Organization on that subject. So I would like to open the session with a longer question a little bit to you. I would kindly ask you to elaborate why it's so important that the health sector takes the leadership in wastewater-based surveillance programs, and how can we achieve the necessary alliance between public health and water authorities joining forces, for instance, as we did in the pandemic response. What can we learn from this, and how can we bring this forward?
Thank you so much, Bernd. Hello, everyone. It's a great pleasure to be here. Many thanks, Bilge and the co-organizers, for organizing this event. And it is not on purpose that Kate and I sitting on different ends of this panel. I didn't recognize the chair next to you, Kate, in the first place. As my heart is always blossoming when there is cooperation between sectors. I'm working at an I'm working at the WHO European Center for Environment and Health, and as the name suggests, it is part of our mandate to make that cooperation between these two sectors as fruitful as possible. And the wastewater surveillance, environmental surveillance, has been a wonderful vehicle also to foster that cooperation. And it was really great to see also on how quick wastewater surveillance programs have grown considerably in response to the pandemic. And the global community was able to establish that in basically no time after the onset of the pandemic. And that was really great to see, if we think of the dashboard of the Johns Hopkins University with showing all the dots in the internet of where wastewater surveillance activities are happening. So that was kind of a great success in a way of the many mushrooming activities around the world. And I should also mention the political momentum that was gained out of that. I'm just, for those of you who are working in the European context, simply the fact that now the Urban Wastewater Treatment Directive is making a proposal for undertaking wastewater surveillance is yet another nice success story of bringing environmental and health sectors together under that piece of legislation. At the same time, we have seen that many of the initiatives that mushroomed across the globe were led by research initiatives, were led by environmental initiatives, coming from within the sector. And I hope I'm not stepping on anyone's toes by saying that actually the examples in which the health sector was taking the lead in wastewater programming, broadly speaking, is quite limited, but maybe I'm mistaken in my perception. But I think there are only at maximum 2 handful of examples around the globe where the sampling results are fully mainstreamed into the public health decision-making processes. And I think, thinking from an end-user point of view, which is the health sector, using the information from wastewater surveillance, I think we need to put the health sector into the lead programming of wastewater surveillance initiatives. So the health sector should basically be the leading organization, the coordinating organization in defining the use that Kate has been spoken about, answering the question on how environmental surveillance data is anticipated to add value in a certain context for public health decision making, having a clear say on designing surveillance programs when it comes to granularity, when it comes to sampling programming like frequency, locations, etc., etc. Agreeing on mechanisms and models for data sharing, but even more important, for data interpretation, of turning the data into information that are useful actually for the public health decision making, linking the data with other data sets like the clinical surveillance or epidemiological information available, but also in terms of coordinating communication of the results that would then trigger meaningful public health interventions in response to the findings of wastewater surveillance in conjunction with clinical surveillance. So I think these examples clearly show that there is a strong need to give the health sector a strong role in coordination and in leadership, but at the same time being the convener of those who need to be around the table, like the environmental people, the wastewater service providers, the environmental departments in countries. So basically being the leader of the discussion so that we make sure that in the end of the day, the health sector, as the end user of the information, has a good say into what programs need to be established and how they need to be designed, how they need to be looked like, so that we kind of maximize the use of the information that comes out of wastewater surveillance. Leave it here for the moment. Thank you.
Okay, thank you.
You're welcome.
So the next speaker is panelist is Tarja. We know Tarja since 3 years. We just met in the first town hall meeting Bernd organized. just at the beginning of the pandemic, and we just met through emails. And after that, we had a chance to meet face to face. And Tarja has a great experience on the SARS-CoV-2 analysis. But my question to you is can you evaluate the possibility of using those great wastewater-based surveillance experience for multiple pathogen or other parameter monitoring, and can we relate all these measurements with the public health in the future?
Thank you, Birke, and
maybe we can use this microphone.
Okay. Thank you, Birke, and thank you, and happy to be here. And I really need to say that our experience so far for the wastewater-based epidemiology and surveillance, it is really positive. So wastewater can be used for getting relevant information on public health. At the Finnish Institute of Health and Welfare, which is a governmental research institute and public health authority, we have actually used wastewater-based epidemiology for poliovirus surveillance already 60 years. We are part of the WHO polio laboratory network, and also we are using wastewater surveillance for illicit drug monitoring. We have experienced 15 years on that. Like Birke mentioned, we were one of the first countries that had a national level SARS-CoV-2 monitoring in spring 2020 up and going, and we have learned a lot over these 3 years. Currently, we are in the process in our WASPAN project, which is funded from the Academy of Finland, together with Tampere University and Helsinki University. We are in the process of developing wastewater-based surveillance for multiple pathogens. So what we have defined so far, we think there are so many opportunities in the wastewater-based surveillance that we need to make groupings. So what we have done, we have defined 4 groups of priority targets for the wastewater-based surveillance. So we have a group of respiratory viruses that have pandemic potential, so SARS-CoV-2, influenza, RSV among those. Then the second group is the gastrointestinal infectious agents. They could be bacteria like Campylobacter, viruses like norovirus, protists like Cryptosporidia. We can have a look on those trends. Then the fourth one is the determinants of the antimicrobial resistance, causing slow pandemic, so there's no need for rapid response in this case. So, but we want to have a look on the longer time trends, spatial and temporal trends, and then the fourth group is this severe pathogens that are controlled by vaccine, poliovirus as an example of those. So this is a long list, but it is not exhaustive. So there are also other possibilities in wastewater-based surveillance. So also biochemical markers for non-communicable diseases. You can analyze from wastewater and get public health information on that. So we are working on that. But lastly, I want to say that based on this experience, it is very important that the priority monitoring targets, they are defined at the national level. So what are the targets, what kind of a population coverage is needed, and also what kind of information distribution, so dashboards, and who are the stakeholders. So that needs to be defined in the national level. Thank you.
So, last but certainly not least, it's my great pleasure to welcome Jennifer Mulvanpa from the Water Research Council in South Africa. I wish we had had the collaboration when Omicron was there. We definitely learned a lot of damage was inflicted on South Africa. We can debate, was it justified to isolate you so strongly? But most definitely, South Africa is the leading country in Africa, I would say, on wastewater-based surveillance. So it's a great pleasure to have you here. And for you comes the question, indeed, on how environmental surveillance of communicable diseases could help in reaching better health security, in particular in low and middle-income countries. Jennifer.
Thank you very much for the question, and I'm happy to be here. I think from the inputs that have been made, a case has been made that wastewater surveillance, environmental surveillance is very much needed. We were able to conduct this particularly for the SARS-CoV, and as indicated, it's not a new tool. It has been in existence, but it has, during the pandemic, proven that it can be quite useful, particularly for low and middle income countries. When we're looking at remote areas and you want to start having early warning systems that can indicate where you have to do your campaigns of education and awareness, where you have to do your campaigns around vaccinations, and where you need to bring in stakeholders to understand what needs to happen. It also becomes very useful because it will enable from the ground information to be reported through to the health ministry, wherein communities can therefore be informed on what action needs to be taken. The critical thing that has to be considered around this is around the ethical issues that also happen, because in most cases, and in Africa in particular, we find that there's a lot of resistance sometimes towards people just presenting themselves for clinical trials, and also it's sometimes very expensive. So when you have that availability of early warning systems that are a little bit not as expensive, then you can put the money where it's most needed, which is either for the provision of your vaccines or else for the treatment, if there needs to be treatment. We have got areas that are also very far away from the metropolitan areas where you've got your tertiary hospitals, and in those cases you may have a clinic where you have one doctor rotating, you know, a few days, 1 day a week or so, and then environmental surveillance assists in making sure that when there is an emerging trend of an increase in a particular cases, then that can be utilized to then start putting more resources in that area and ensuring that you are able to address the challenges as they come. In South Africa, this was also found that there was a serious correlation in terms of the data that was found from the clinical trials, the clinical assessments, as well as the environmental surveillance. So it is a way of saying, going forward, we can use it for other also pathogens, but also we need to say that when we are now looking at more sustainable wastewater sanitation systems, how would you do that? When we're thinking and imagining the future around this, you could actually have these sensors built into your sanitation system, your toilets, and you can be able to detect the health of the people and be able to focus on what their health as a preventative measure, and also being able to treat before there's big consequences. Thank you very much.
I think we can go with the Q&A session. We have some questions that we received during your registrations, and we will try to direct some of those questions. Not possible to direct all questions to our distinguished speakers. So the first question is for you, Ricardo. Can you give us a few examples for the population surveillance in non-sewer settlements? This question comes from the Netherlands, from reaction? Okay, okay, yes.
So I think somehow our colleague from South Africa actually explained that there were efforts in some specific areas of, in this case, the African continent, to actually run these activities. And I would say these have been there, but they're still quite limited. My suggestion moving forward would be indeed to expand on this on a national basis, as we also heard from other panelists. I think despite having been taking place, we are still not keeping up with the pace as in, for instance, in Europe or I would say mainly in the European continent. So that's actually, I would say, I would turn this question into sort of a recommendation moving forward, because the examples that we have, at least from the African continent, are quite limited at the moment. For example, at least where I'm based, I cannot recall actually having seen much action in this specific continent, in this specific country. So let's, let's continue in this effort and join hands to make sure that every country can have a proper surveillance system in place moving forward. Also affordable one, I would say.
Thank you, thank you. Kate, for you a question which I think is just really made for you, because I know that you care very much indeed about the poverty dimension, and the concern is there that resources are deviated. So basically the question is, how would you expand surveillance to non-sewer sanitation? This is very much related to what Jennifer described.
Yeah, so I think firstly, when we're talking about non-sewer sanitation, and you mentioned the poverty dimension, I mean, it's really worthwhile remembering that that's 50% of the global population is on a septic tank or a pit latrine or nothing. Some of them are waterless systems, so wastewater surveillance is not possible where you have well, okay, maybe if you're getting into the sludge, but also to say for polio, which is a disease of poverty, the places where polio pops up is where there is no sanitation as well, right? So they've been using open drains for polio surveillance for a long time. Those are non-sewer systems, they exist there. So I think we have examples where it can be done, and I agree it would be interesting to kind of expand wastewater surveillance to non-sewer systems, but again, we need to kind of know why, what's the purpose of doing this, why should we invest there? And from WHO's perspective, we're always talking about preventive risk management, right? So you use your surveillance really as a way of seeing whether your preventive risk management is working or not, largely. So we don't want to spend all of our time kind of looking for the bugs when we know there's some basic preventive things that we can do, like washing your hands, like using a toilet. There's all of these things that we know are going to prevent infection. So I think we need to find that balance of understanding where we invest in basic services and where we can use those sanitation systems to advance environmental surveillance for diseases. And of course, not all of these are sanitation-related diseases, but that's another dimension that maybe would take a bit longer to unpack.
Very good. Over to you. I suggest we take one more question for the sake of time, because we're running behind schedule.
Okay, Bernd, I'm repeating the question, sorry. Take the advantage of lab capacity built for disadvantaged communities.
Well, I think one of the things we've seen in collaboration and also coming out of African examples like from South Africa is that well, it was not the lab capacity that was limiting the use, and what also struck me was that the fact that let's say the wastewater surveillance also helped promote the use of these types of this lab capacity and these tools would also help to expand the surveillance opportunities for wastewater surveillance, but also maybe for surveillance of water quality in other areas. So I think, for me, the lab capacity, for what I've seen, is that the lab capacity was not the main limiting factor. It was maybe more difficult to find the right sampling sites and to get the samples to the laboratory. That was the limiting. I'm hopeful that, as I said, because we use these PCR tools now, and they are sort of you can expand them because they are so fundamental, so you can sort of build on it and use it for E. coli, use it for the pathogens and the antibiotic resistant genes that Kaida talked about. So it is super nice to see that such a fundamental method has now also got more expansion and capacity building around the world to use in wastewater surveillance, but broader in environmental surveillance as a whole.
Okay, thank you. And when we are talking about those capacity building things, we are always talking about Africa, not about Asia or the South America. I think we are not talking about that. We are mostly focusing on the Africa, huh? I think
Maybe my bias because we've been involved mostly in collaboration. So
yes, yes.
Maybe that's
okay.
You got a point there, definitely. That's something we have to improve.
Yes.
Bilge, I know that we have other questions, but we really, for the sake of time,
thank you for the first
please an
session
applause for
speakers.
the panelists. Thank you so much for being with us. And I suggest we change.
Yes.
So we call in Amy Kirby.
For the session 2, we will invite, yes. In the session 2, what we will do, we will discuss the methodological developments in wastewater surveillance, especially focusing on the monitoring other pathogens, viruses, antibiotic microbial resistance, contaminants of emergent concerns, and then we will discuss the contextual applications and adaptations both in developed and underdeveloped environments. And speakers from the CDC, Centers for Disease Control and Prevention, Dr. Amy Kirby and Dr. Vincent Hill, Dr. Sipra Kumar from Bill and Melinda Gates Foundation, General Molantva will be with us in this section 2 again, and Professor Ana Maria de Rosa Guzman from the National Institute for Public Health and the Environment, and Yogita Upadhyaya Musa from World Bank. Yes.
An applause. They deserve it.
Yes.
You start.
Okay. So during the pandemic, this is at the beginning of the session. We already discussed this. There are different methods. The different countries are applying different techniques because the conditions are differing from country to country. So now I would like to start with Amy Kirby. CDC is a great expert on this lab analysis. And Amy, can you talk about the methods that we developed during SARS-CoV-2 pandemic for the wastewater surveillance, and what kind of laboratory is best? What are you thinking about the different techniques, different pre-concentration techniques, different PCR techniques? So what is your approach for the lab analysis of the SARS-CoV-2 and certainly for the other pathogens and viruses?
That's a lot. You threw a lot in that question. So I think it might be useful to sort of walk through the methods that have been used and where we're going. So for polio, which we've already heard about, the method used there for decades now has been culture, because it's very specific, very sensitive. You know exactly what virus is there, but it takes a long time, and it's not quantitative. So you know, is it there, is it's not, but you don't know any kind of quantification. When Gertchen, as we've heard, started leading the field and doing SARS-CoV-2 wastewater surveillance, we knew that one, we couldn't culture it out of wastewater, and two, presence-absence wasn't going to be enough for a pandemic virus. We needed something that was quantitative. And so PCR was the answer there because we can get good quantification, it's sensitive, It's specific and it's fast, which has really been a key for a pandemic that moves as quickly as COVID. At the beginning, most people were using real-time PCR, which works quite well. We've seen in the past few years a transition to digital PCR, and the reason there is because it's better, it's more accurate for quantification, which is great. But I think more importantly, it's more robust to the inhibitors that are present in wastewater, and so we get better data out of digital PCR. So right now the US system is accepting both real-time and digital PCR, but as we expand to other targets like AR and norovirus and influenza and some of the things we've already heard discussed, we'll be switching our entire system over to digital PCR because that is a more accurate measure. As we look forward to the future, PCR is wonderful, but you have to know what you're looking for and make decisions. And we've already heard a bit about that from Tarja and others that you can only test for so many things in a cost-efficient method. So you have to make decisions about what are your priorities, and you're obviously leaving some things on the table untested. And so where we see the field going is towards metagenomics, so sequencing all of the RNA and DNA that's present in the sample and let the sample tell you what's there. It's not quite ready for prime time yet. Metagenomics is not as sensitive as PCR. It is not fully quantitative yet, so we don't know how to understand that. But there's lots of good efforts to develop that, and our expectation for the National Wastewater Surveillance System at CDC is that we're probably about 5 years away, 5 to 8 years away from shifting the system from digital PCR over to metagenomics, so pending the technology getting there. The one thing I did want to note, so those are all what you can do in a fully, what we would call a high complexity molecular lab. There's lots of development also of field deployable systems, so take the sample and test it right there in the field in a mobile lab. And so I think that's a really promising development that we've seen come out of private industry. And then the last thing I want to touch on is there's also interest in developing what we would call real-time monitors. So you drop it down, a piece of equipment down into the wastewater system, and it just starts testing all the time, and it's beaming data to you, and no one's having to take a sample. I think those are really interesting applications. I do worry about the flexibility because you're kind of locking yourself into a target and you're not able to rapidly adapt if you don't have a lab ready to do that test. So lots of development in the field with methods, but PCR still seems to be the workhorse that everyone's relying on right now.
Beam me up, Amy. She used the word. I was watching Star Trek. I saw what's going to come. And I want to have a selfie with you because I'm following her so long time on Twitter. And finally see her, so this is a great moment for me.
I promise to tweet it for you.
Thank you. So, thank you, Amy. Sabrina, of course we have to talk about the reality which Kate mentioned as well, the 50% out there which are not so privileged, the low resource settings. And I would like to ask you, what are the considerations in terms of technical adaptation, adaptability, or redesign of methods that are used in low resource settings, and specifically indeed on how you try to promote this?
Yeah, thanks, Bernd. Yeah, so there are definitely technical challenges in taking wastewater-based epidemiology to low resource settings, and there's two that maybe I can highlight here. One that everybody's been speaking about, there are large proportions of the populations in those cities that are not connected to a sewer. But what does that mean in terms of the technical methods that need to be developed? Well, if you think about, for example, an African city with a river flowing through, where most of the human waste is going into that river, we need to decide where on that riverine system to sample. And then based on that sample, how many people are represented in that sample? In the United States and New York or in Seattle, where I come from, you could just go to the wastewater treatment company and ask them, if I took a sample from this plant, how many people are represented? But that is not the case if you were sampling on a river. And so then you need to develop the mapping tools, the mapping skills, including digital elevation maps. And then, many of these countries don't have regular censuses, so you need to estimate population and population growth. And all of that, if you want to do epidemiology, you need the denominator population. And so you need to be able to estimate the number of people that you are sampling and surveilling. So I think that is one big technical challenge. And like Kate said, you know, it has been tackled for 4 years, so it's not undoable, but it does require resources, and we are committed to that. The other technical challenge that I will point out is, you know, something that Amy was alluding to. We are still in a world where we are targeting pathogens, and the pathogens that are priorities in low resource settings are likely to be different from the ones that are priorities here. They're also likely to be different between low resource settings. And so I think there is a need to develop the tools that will work for those settings. And to be clear, that development is underway, and people in low resource settings are leading in developing some of those tools. But I think it would serve all of us, the global community, well to have them at the table so that we can collaborate on that.
Thank you. Thank you so much for
Okay, Anna Maria. With the start of the pandemic, we have started to talk about One Health approach, and maybe you can make a brief summary of what we mean by One Health approach, first of all, and how can we integrate the wastewater surveillance studies to this One Health approach? What is your opinion? Can it be integrated to the One Health approach in the future?
Yes, well, it's a real pleasure to be here in New York. I think it's great to see that water is now at the front. Once again, has a big stage, and it's also surveillance, which we are a big fan of. I think with respect to your questions, I think some things that need to be pointed out are that we hear a lot of talk about there's so many pathogens that we can test. So I really agree with the other speakers that prioritization is in order, because I think it can be very overwhelming, and I think it's very important to just talk with local stakeholders. So have the clinical field at the table. What is your need? Which pathogen is really at this moment most urgent? What did you need more information on? And as we heard in previous meetings, it can be very different. It can be probably cholera or TB. And I think we should realize this and then really celebrate a success. So if you can pull this off for cholera at that local situation and make sure that the data are shared and that actually you proactively decide on the response. So we know that the scientific community is very interested, and they will develop methods for anything. But it's very important to have the public health sector in the lead and decide beforehand what would be the response if we would find anything. And I think with respect to One Health, we now know that, of course, this concept that captures not just public health, but also environmental health and animal health. It's very important, for instance, now with the outbreak of the bird flu, to realize what kind of sampling strategy do you actually need. Is it wastewater surveillance, or actually do you need to monitor the surface water? And that comes back, of course, to the point of sometimes it's surface water that you need to sample and investigate. So I think with that respect, it's very important to develop these tools to see what's the priority pathogen at that local in that local situation, but also over time. So what's the most relevant emergency? And that's also a new point. A new thing I would like to point out is that we also know that there's a lot of displaced people in the world, and I think we should also really focus on emergency situations and see how this tool can be used also in those situations. So I'll leave it at that. Thank you.
Thank you. We move on directly a little bit artificially to section number 4 because it directly connects to what we have heard before, what we thought this is a very important opportunity, and we need to tackle a little bit more the contextual applications and adaptations of wastewater-based surveillance in developed and developing environments, sewer and non-sewer context. So the question going to you, Jennifer. I'm a big fan of what you do, so I'm laughing all the time here. So, in my regards to the colleagues at NICD. So how not so much talking, oh, you have a microphone, yeah. Not so much talking about the methods and what you do on the programs and where you go, but we would like to hear from you a little bit more on how do you actually use data on communicable disease to detect by environmental surveillance to direct better measures for health security in low and middle income countries.
What we did, the experience of South Africa during SARS-CoV-2 was that we had a partnership with the Bill and Melinda Gates Foundation and the Water Research Commission. And through that process, we funded the NICD, which is the National Institute for Communicable Diseases, and how then they then conducted these tests and were able to predict one of the waves that I think it was the Omicron wave or wave 4 of the pandemic. But what is important is that we also were able to have then, through those partnerships, have the Department of Health being informed. And the other ideas that have come through from these lessons is that you can actually then also utilize it to get your medical health professionals prepared in terms of where must they be moved to in order to be able to at least put more resources where they are needed. We are also able to do, like I indicated earlier, some of the campaigns, the education and awareness becomes very much important. But also it requires that there be a lot of training as well that happens across the board to ensure that there's an understanding. I think it was very much important what everybody also highlighted around national policy and the decision making around what needs to be done so that that can be well directed and eventually make a difference in our countries.
Anna Maria, you are the fan of Jennifer and I am the fan of Anna Maria. So my next question comes to you. Yes, Anna Maria, you know that during these 3 years we collected lots of data. We have lots of data, and my question for you is how valuable this data is and who is using this data? I mean, what can we do with this data? Okay.
Yes, I think that's a very important question, and I think it has been addressed also previously. So I think this has been addressed before by other panelists, but I think it's important that we get the data out there, but it's also very important for people to understand what the data means. And with the public health professionals that have to make decisions based on the data, it's very different how you communicate with the public. But it's also very different when you either address the medical profession or when you address the wastewater people, because I think the water sector and the chemical sector also use different language, and so it's very important to share things, but it's also very important to make sure that the communication is in place and that people can understand the data. I think one important difference now with the COVID-19 is actually that we quantify the virus. And so we have trends in viral loads in the wastewater, and that's very different from what we did before. So with polio, it's a very different type of data. Now in this polio eradication era, you see that whenever we find polio, we are alerted and something needs to be done. I think in case of SARS-CoV-2, it's there, and so it's a very different way of dealing with it. And so every different pathogen has its own governance structure. So it's integrated in a different public health setting with different professionals. So that's really something to think about. For every pathogen, we need to think about the local action perspective.
So we heard already the dirty word money. And it's my great pleasure to have the World Bank here. There are other donors and sponsors in the room. And I find it particularly interesting when these two worlds of research on one side and financial aspects are colliding. It works surprisingly well. Sometimes there's a lot of work to be done before they understand the same language. So, Yogita, for you, a little bit longer question. Can you elaborate a little bit on how we can help to expand and adopt wastewater-based surveillance through capacity building? So what is, for instance, the World Bank doing in supporting public actors to expand their menu of options when it comes to surveillance and preparedness for future events?
Thank you so much. This is working okay?
Yes.
Thank you so much. And yes, you're right, it's a different language. I have to say, it's incredibly humbling to have such scientists and engineers and technicians, and some of which I admit did not understand all of the terminology. As an economist working in the sphere, but it's really great to be in this conversation. And the pandemic brought so many terrible things. And one of the few positive things that came out was greater collaboration between water and health. That's what we saw in the bank and across other sectors. And it also brought all of us together to work really quickly and mobilize the financing quickly and mobilize the support quickly. And it's what the previous colleague said about the sewered and non-sewered, that's very relevant to the World Bank and our clients, our client countries. So where we started supporting stakeholders with wastewater surveillance happened to be, I think, one of the reasons happened to be where there was more wastewater facilities. So Mexico, Uruguay, Ecuador, Morocco were some of the initial starters in June 2022, where we worked to support stakeholders on wastewater surveillance, initially focused on COVID-19. But through time, in some of these locations, for example, in Ecuador, in the city of Guayaquil, it's moving on to retrovirus and hepatitis A, and Mexico is evaluating resources to look at fentanyl. So these are expanding. In those cases, we developed a sort of a guidance and guidelines for these countries to expand from initial cities to national and to increase in scale. So it's taken a lot of resources, support, hand-holding, focusing on those countries, and then the idea to move beyond in other countries. And I would say in a lot of projects since then, through all the continents, where we have wastewater projects, this is becoming more of a topic to include. But what's become clear is with relatively limited resources are always limited, building on local capacity, bringing in the experts, building up local capacity. What's been really critical is to mobilize local leadership and coordination amongst local stakeholders for community-specific adaptation and methodologies on one hand, and on the other hand, working with national and regional governments to sort of put in the quality standards, and obviously some of the financing is coming from that direction as well. So it's really both bottom up and top down is what we've seen. One other source, you talked about financing, we're hopeful that the pandemic fund, where we mobilized $300 million, where the World Bank is hosting, but WHO is technical lead. We're hoping the pandemic fund can be one way we can bring wastewater surveillance further. And we're seeing that capacity building lower and lower income countries is going to really be a priority. We're working on some guidance, some guidelines on this as well.
Last question goes to CDC. Vincent, yes. What do you think about CDC? What do you think about the application of the wastewater surveillance for low and middle income countries or ministries of health to implement these surveillance? What are necessary? What are needed for these countries? What is your opinion as CDC?
Thank you very much for the question, for your hospitality today. Much appreciated. And of course for the opportunity to participate here. Much appreciated. First I think it's really important to be clear that considering for identifying goals for wastewater surveillance, how the use cases, how the data can be beneficial, and of course then informing the capacities needed to implement wastewater surveillance really needs to be led by ministries of health, their local partners, and government agencies. And that's really where it needs to meet their needs. And so that's really important. Now, organizations with the expertise in wastewater surveillance, like CDC and many others, can provide technical assistance based on their experience. Absolutely. And at this time, I'd say our experience is mostly related, especially here at CDC, is related to sewage systems in a high-income country setting. So we're learning more. We've heard from Gertjan, he's got projects. I've been talking with others as well. It's very exciting to see so much activity now being focused on, we've heard from many panelists, about non-sewage systems and how this could be effective in those kinds of, we have a lot to learn though. And I think that's very important to evaluate various approaches to implementing wastewater surveillance, to understand in the low and middle income country context, frankly, how to do sewer system surveillance, as well as of course non-sewer systems. It becomes so different in different contexts and different settings. I'd say one area that we've been very much focused on at CDC when we're working with partners is the area of how do you assess the capacities that are needed for environmental microbiology. To all the virologists in the room, we do include you in environmental microbiology. That's just the term that we use, that to encompass it all. But what's needed to do the sampling? Gertjan talked about that. It's not very much focused on, maybe, it's not the first thing everybody thinks of, but that is the most critical part. Where do you go to get the samples? What's the most effective place to find them? How do you actually physically, logistically do it and get them to a laboratory? But then laboratory testing, what the capacities are to actually do the testing. In many countries in which we've been partnered for a while, the capacities currently are pretty limited. Maybe fecal coliform testing might be where they're at. How do you get from there to PCR, to metagenomics, or genomics? How do you do that? What are the decision trees for doing that? What are the resources, the guides, the toolkits that can be provided? How do you set that up so that there's a roadmap, so to speak, of how to get there and what the factors are for doing it? Beyond that, data management, data transmission, all those kinds of pieces really need to be thought through in order to be able to do that basic part of just the data generation and the data transmission and using it. And then the other important area then, of course, for us, epidemiology. So that area of capacity assessment and need. From the start, of course, where do you need the data? Where are the community needs, and where do you need the data from to collect the sample? So epidemiologists are very important, obviously, for that. But then data interpretation is a critical piece of this. And then linking that data up to other sources of public health data. How do you do that effectively for the different diseases and applications that you're interested in? So those are two big areas of kind of capacity assessment that we're interested in and working with partners on. And then I think the last piece for us, and we've heard it a number of times, the cooperation and collaboration between I'd say ministries of health, Ministry of Water, environment, this kind of cross-sectoral collaboration is absolutely critical. And so, that's a big focus for CDC, frankly, in our own country, is linking up health departments with their water utility partners, et cetera. They don't often work together very often. And here's an opportunity to make those connections. And so that's a very exciting part, but also can be very challenging. There's always sorts of things you have to work with there. So those are some areas that we're interested in. So we're working on, setting up, I think, standardizing this as much as possible. We're providing frameworks, decision tools, guidance documents, those kinds of things that can be helpful to get, people and partners started is really important. We do have some demonstration projects. I was really interested to hear Gertjan's in Kenya. I think it was at least one that you were working on. And so we have some similar demonstration projects focusing on trying to learn from our own perspective, sewer, non-sewer, septic, and then latrine-based wastewater surveillance. So we're all learning together and hopefully sharing information. The last point I'll make around sharing information is we're interested in setting up frameworks for communities of practice around wastewater surveillance in global settings. And so we've been very fortunate. We're working with the Water Environment Federation and Association of Public Health Laboratories on this idea of setting up frameworks. How do you set up communities of practice? What are the different aspects of that? And so I think that's going to be really important for peer-to-peer learning and technical assistance as well.
Thank you so much. Thank you. We take one very short question. No, I got a hold of it. We have 20 minutes left, and I think nothing is as good as to bring people together about different sectors if we talk about money. I really believe that that is what you have to tackle, and that's my question to the Gates Foundation. If you are aware about sustainable business models for wastewater-based epidemiology involving the private sector, do you have examples which you can nominate?
Yes. So at the Gates Foundation, I think people are aware, we do have a lot of experience working with especially vaccine manufacturers, ensuring that vaccines that are manufactured are available at affordable costs to low-resource populations. I think the experience with surveillance systems is less, but to the extent that we are developing tools that can be used in low-resource settings, and to the extent that for-profit partners are working on such tools, I think there is a need to create these tiered pricing models that will allow the tools to be used in high-resource settings at a price point at which it is able then to be subsidized for low-resource settings. And we have some experience with that kind of thing, and we would be happy to work with for-profit partners. It is important, let me say also, that there are these for-profit partners at the table, right? They need to come to the table, and it's great to have some of them in this space. You know, we're talking about aircraft-based wastewater surveillance, tools for, qPCRs and genomics. All of those do need to be subsidized for low-resource settings, and to have those willing partners is super important for scale.
We do have a traditional wastewater-based epidemiology to be late. And this is a tradition, we continue this tradition.
Now,
So
okay,
we have to
thank you
change.
for the panelists, and
And of course,
I think we are coming to the most important part for all of us, because why we decided to propose this side event to the United Nations, we worked together with all panelists. And we made many meetings together, and we especially focused on the last part, closing part, and we will talk about the closing aspects of future aspects during the closing part. And I would like to invite those 8 speakers or panelists to the platform again, and we will ask very short questions, and this will be the last wording from our panelists. Okay.
So, Katja.
And, okay, I will start with Gershon. So very simply, what is your opinion about the future of wastewater-based epidemiology? It will continue or it will end? So.
Well, I am positive about the future of wastewater surveillance. I have 4 areas or elements that I see. There may be many more, but the ones that I see. The first one is coming from the work we have been doing with municipal health services. I think they are learning it's another tool in their surveillance toolbox, in the toolbox to fight communicable diseases, and expanding it from the COVID situation, where they also had to learn this new tool, learn to know what it can do and cannot do. But now we've been seeing examples with an hepatitis A virus outbreak in a school where they said, okay, we can use the wastewater to look at silent circulation of the virus. So I think those are elements where they start to learn by doing and recognize the added value of the wastewater surveillance. So another tool in the toolbox. And then I also see, well, certainly with Anna Maria in our country, that the national program will continue, but I think Tarja also mentioned that. So I think we see the added value of looking at in the wastewater as an unbiased information. So currently, if you look at our national dashboard in the Netherlands, you see wastewater. Of COVID, you see wastewater is the leading indicator because we sort of gone blind with all the other types of indicators. Not completely true, but mostly. So I think we've learned that there's a role there. Then I'd like to come back to what was said about the lower middle income countries and the non-sewer settings. I think we see examples close by, for instance in your country, but also in Ukraine, where you go from a sewer setting to a non-sewer setting overnight or over weeks. So I think it's also very important that we see a lot of scientific publications and communication about sewage surveillance in high-income countries, but that are quite some initiatives of use of looking at wastewater in other types of settings. And I think it is also very important, Vince was also alluding to that we learn, that we see those examples and that we learn because it's more complicated. It's relatively easy to do if you have sewers and wastewater treatment plants because you know where to sample, but it's more complex, so it also requires more information sharing on good practices, good ideas on how to look at population sizes, where to find your sample, etc.
Okay.
So, well, one final, the big dream, and that's we are sort of living that dream a little bit today, and that is the global collaboratory. What I see is that. Bringing together these data on a global scale, and you may we've been working with Michigan State University and University of California, Merced to try and bring together the data. But I do see that bringing together this information on a global scale could be also some sort of global sentinel system for infectious diseases, but also emergence of new pathogenic viruses that spring up in some region, and we can quickly see that, share that, look at transport hubs to see the spread of that. So what I envisage is a global collaboratory in data sharing and a global collaboratory also in good practice sharing. So. Yeah, okay. Exactly. So I'll stop.
Thank you, Katja. So we were running up the hill, so I'm now Bilge, she's down.
Yes.
As Kate Bush
I'm
sings.
sorry, you're good.
I'm talking. You know, in Germany, I like my plan, getting to battle, because goes.
Okay.
So let's continue. You mentioned something very important, which is the continuation, the global collaboratory, as you called it. So the next question, Supriya, again to you, I would like to connect a little bit. So what is actually needed to ensure that low resource settings can take on wastewater-based surveillance so that we continue? I think the realities are different. Of course, the obvious answer is money, but I think it's a little bit more complicated.
Yeah, I think it is more complicated. Okay. And guidelines have been mentioned a couple times for the World Bank, and I don't know who else, but somebody did mention those. I think those are key, especially when we're looking at many countries and we want them to take on something new, a new surveillance system or surveillance for a new pathogen. I think the guidelines are going to be key, and maybe it is the WHO that will develop those guidance documents, but I think all of us can support. So that is one piece of the puzzle. I think that also I wanted to highlight equity. I think wastewater-based epidemiology does have an equity angle, and Jennifer mentioned this, you know, when there are populations that are not served by healthcare systems or unwilling or unable to access healthcare systems, you can actually surveil them through wastewater surveillance. And so there is and opportunity for better equity through wastewater surveillance. And on a global scale also, I think bringing in those low resource settings and having them at the table, collaborating has been mentioned, but collaborating with them in the development of tools and ensuring that pathogens are prioritized that are relevant for them and for us, I think is the key to even a global sentinel surveillance system.
Okay. The next question is for Jennifer, and very simply, what do you consider about the intersectoral partnership in the low and middle income countries in the future? I mean, water and health partnership for the wastewater-based surveillance studies.
I think that doesn't really have to be low and middle income countries. Cross-sectoral partnerships are important, and I think throughout the conference, in the different settings, it has come to light. You know, there's always financial resources that needs to be put for every single, you know, work that needs to be done. So the more you collaborate, the more you share resources, the more the money can be spent and go further. And so that's very much important. But also the role of the private sector becomes very much important, particularly in improvement of health. The role of partnering public-private partnerships is very much important, but not leaving behind the most important partner, who are the citizens. Information, transparency, and objectivity needs to be at the center of consultation, education, and campaigning, so people get a buy-in of what is being done. Unfortunately, most of the time, people get the information of, we're going to vaccinate you, and people just say, but why? And then the whole story starts. But when people understand that the world is moving in this direction, we need to, there's an overgrowing population, the cost of doing nothing is too high, and therefore the reasons we are investigating some of these solutions like we're talking about today is to ensure that we keep more people alive, we prevent pandemics such as the one we've experienced. Then people start anticipating that there may be a role that they need to play. People start anticipating that there are positives that may come out of that and benefits that may come out of that. So those partnerships are very much important, but let's not leave the citizens behind because of the fact that they may be ignorant, or they are in far-flung areas, or they may not know, because to get them on board to come and participate, and I think that's why I also mentioned earlier the issue around the ethics of it all. If people are not made part of the decisions and things are done for them, they tend to resist in most of the cases. So I think that's how I leave it. Thank you.
Thank you, Jennifer.
So you mentioned indeed the need to engage, and engagement for very complicated matters requires visualization. So the question to Professor Saatchi, what about the importance of digitalization activities for nationwide surveillance studies? Because there's the screen, and then there's of course the digitalization which is behind the screen.
Yes. The short answer is again the money. That's why we digitalize. We use lots of manpower. Actually, it was bigger power that we use in the system. So, first you decide the location and the time. If it's raining, then you do not sample. You know, you dilute the sample, of course. And then you have to take the samples, transfer them to the laboratory. The laboratory makes tests and the results. They go for interpretation to our universities. Then we try to disseminate the results using the dashboards, etc. So it took lots of manpower and lots of money, of course. So by digitizing it, we are hoping that we will have it much softer and with less expense and less manpower. And we have started to work on it. It has about 6 stages. Some of the stages I don't understand because it's computer science part. Therefore, I will read it. The first is gathering, analysis, and requirements. Then you design of project phases. That's all in one diagram. They want a diagram, and software requirement documents. And they want software requirement specification. We finished this part. We are bidding now. We have the specs ready. And mock-ups, what whatever that means. It's user interface prototypes, I think. I don't understand it. So coding comes, that I understand. I have done some coding. So the last is testing in pilot cities, Indian, or then the population of some European countries. I don't know how it will end. Thank you.
Bernd, sorry.
Okay, the question comes to the Ricardo, related with the training. So, okay, we talk about capacity building projects, we talk about the low and middle income countries, spread of the wastewater surveillance for those countries. So for this, certainly the first must is the training. So what do you consider about the training programs of wastewater-based epidemiology? What is the picture in your mind about the training of wastewater-based epidemiology, especially for the low and middle income countries?
Yeah, thank you, Birgit. It was very interesting to hear that basically all of us here mentioned training and capacity building. And I think that's already a great stepping stone to move forward. There is definitely such a demand, and I think we might all agree that everything starts with education. So we got to start from that very simple thing. And the good news is that there is already quite some good stuff out there that we could tap into. And I think this is a great opportunity to showcase genuine collaboration. I mean, we do have the means. Now let's spread this good tools, knowledge to where this is needed. And I think we could also agree that this is not something that we should keep to ourselves. This is something that is beneficial to each and every country in the world. So starting with this genuine collaboration through training, we can definitely do something very, very good all together. I would say expanding onto areas where this is not yet a reality is, I would say, the second second milestone after providing these training programs. It's not something too complicated, but it has to be genuinely shared. And I would say also we started with COVID. Now we can also push forward and understand something a bit more complex that will require also more training and resources such as AMR, for example. Last word, we have all these tools. The fact that we are sitting here today means already that we are partners in some way. There are also other established partnerships that we can tap into to do that. So I think my message in the end is very positive. We just need to continue, and there is so much potential to do that. Thank you.
Thank you. Thank you so much. And continuing, I would like to ask the next question to Tarja, because Tarja, as a leader in the National Health Security Agency, like Anna Maria and Amy, you are the ones who kind of could give us the vision, and this is the question to you, how to establish collaboration with worldwide centers of communicable diseases and global and continental health initiatives in order to develop this so much and so often mentioned early warning systems for what Bill Gates called pathogenics. So how could this work? What is your vision on this?
Thank you, Bernd. So I think that at the moment this is the momentum. And I think that the way forward from here is actually the regional and international regulations. So I'm from Europe, so I know the European regulations, what is coming there. So Urban Wastewater Directive is one, but then we have also these updates coming to the regulation on serious cross-border threats to health. And then we also have the early warning and response system of the European Union. At the global level, I know, to my knowledge, there are also revisions coming to the international regulations. So this World Health Organization's global pandemic agreement, and then also amendments to the international health regulations. So I think it is of utmost importance actually have wastewater included in these regional and international regulations. So it is the answer how we could expand using of surveillance. Well, there is a lot of work to be done still. So like mentioned, all the countries should be included, update the wastewater surveillance in all countries. And then we also have method harmonization needs, and to be able to compare the results from place to place, we also need to have quality assurance and quality control. Thank you.
We mentioned again, so you already talked about the One Health approach, and I will ask a very simple question to you. Are we going to apply all these wastewater surveillance activities in the future sustainably for the detection of other pathogens, viruses, antimicrobial resistance genes? What do you consider about this?
Well, thank you very much. I think we haven't been talking about antimicrobial resistance that much, but I think we should realize, first of all, it was mentioned that this is a silent pandemic, and it really should get more of our attention, also in wastewater-based surveillance. I think it's important that there's many lessons that we learned already from AMR and looking in the wastewater. One major achievement with respect. I'll continue. So one major achievement we had in AMR was actually that we showed with a global study that we could see differences in levels of uptake of sanitation initiatives and safe sanitation management, and that actually these global studies really help us to get this awareness about sanitation. So I think next to education, communication, I think it's really an important lesson from AMR. I think we addressed already a couple of points many times now in this panel. So communication is important. Everybody should know what you can and cannot understand from the data from wastewater. With respect to education, I think we have a challenge. There's already a lot going on, but we have to realize that it's very different when we educate our young water professionals or when we educate our young clinical professionals. That's very different. But they both need to be on board with this new initiative. I think with respect to solutions, there's also something to think about. So I think it was already mentioned by Kate before that if we then see that there's certain diseases going on, then it helps to survey, because then you know where to look. But actually, we should resolve it. So if something's going on, it should lead to a certain action. And I think one important global initiative could be to really have a research agenda. I think there's a lot of initiatives all around the world, but for instance, one major question that's still open is that for respiratory viruses, for instance, we would never look in feces. But so there's very scarce data, but to be able to understand the data that come out of wastewater, we really need to know also for respiratory pathogens what's going on in these samples. So I think in the research agenda we can address a part for everyone. So I think we all have a role to play.
Okay, thank you. So the Netherlands are very
Well, they took the co-presidency of the water conference for good reason. Thank you so much. We are almost at the end, but we started with World Health Organization, so thanks again for the colleague, and I would like to end with the World Health Organization with the question to Oliver. I think you can answer it maybe jointly together with Kate. And the question is about what opportunities do you see to cooperate with the existing platforms? It has been mentioned several times. It is clear there is a willingness and an interest to bring bigger regions together, but there could not be one region taking the lead. So we need you guys. So over to you. Okay.
What a nice lead in, Bernd. So I understand I'm standing between you and lunch. So let's try to make that short. I think, yeah, everything has been said. You need cooperation, and we need communities of practice, we need mutual learning, and we need peer-to-peer support to bring wastewater surveillance at scale. I would like to make 2 points in that direction. I think that the research community is actually very well connected, and they have very strong networks in exchanging information and in supporting each other, and there are established platforms for that. When it comes to the governance side and to the regulatory side, it is not that easy, right? So in terms of making sensitization to the benefits of wastewater surveillance, nudging the establishment of supporting frameworks, governance frameworks or associated regulations, but also fostering understanding of which stakeholder can play which role in making that a working concept in practice. So one of the examples I would like to use is again from Europe, unfortunately, I apologize for that, but in Europe we have a multilateral instrument which is called the Protocol on Water and Health, which brings together member states, both from the health sector as well as from the water and from the environment sector. And this is less the research community, but this is more the government representatives who are in charge or advising decision makers in the ministries, on the general directions to be taken. And I think that is a very effective platform through which we can do that advocacy for adopting wastewater surveillance, but not only that, it also serves as a platform for organizing a community of practice, for organizing peer-to-peer support among countries, and in organizing capacity building, and organizing sensitization, and using it as a hub for knowledge sharing at that very level. And it is not I think it's not by chance that in the latest cycle of that Protocol on Water and Health, where the work program was defined for the coming 3 years, virtually each and every country was proactively voicing that they would like to address wastewater surveillance as a matter of capacity building, but also very much in terms of receiving practical support with the rollout. So I guess my point is we should use existing platforms that we have at hand also for making the case for surveillance and for organizing broader support. So that's the message I had for this panel. Thank you. If you want to compliment, I give you the mic. Yeah.
Well, I just wanted to say that if I'm reading the room, I think there's an appetite for some guidance and maybe some WHO headquarters leadership with some global coordination towards multi-pathogen surveillance. All I wanted to say really is that I'm kind of cautiously optimistic that we could take up that role, and things that give me optimism for that is that we have great relationships already coming through CDC. We'll chat about that afterwards, through the European Commission, through the amazing research networks that really consolidated around the COVID pandemic, the work that Gates Foundation is doing, looking at multi-pathogen surveillance and new research coming in. The reason for the caution is because I think for WHO this is going to take a kind of a radical level of coordination that we're not familiar with. Well, we are familiar with it, but it's hard, right? So I think I've heard Anna Maria say before, the lab methods will get to the other bits that are hard, and that resonates with me, that you look at the way that the health sector works, and not just coordination with the water community, but within the health sector, you have these very distinct disease silos, and we talk about breaking those silos all the time, and we're trying to do it, but it's a challenge, and it's a challenge we'll have to crack in order to do this well. So yeah, just to say we're interested, we're working towards it, but there are some hurdles we need to tackle. Thank you.
Okay, the last verse for from
Okay, I
Professor
know we are
Sargent.
out of time, but since we are talking about future, you know that we had a devastating earthquake and 14 million people were affected by it. We'll have 100,000 containers for 500,000 people and 300,000 tents for 30 tent cities or towns, as I should say. So they will need water, they will have wastewater, and in camps in Syria, cholera already started. So we will use this methodology, wastewater monitoring, surveying, to detect certain diseases with the help of the Ministry of Health. Thank you.
Okay. We also invite Ana Burgos for her announcement, and then we will close the session. Yes, you can.
Yeah, many thanks for having us and for hosting us. I think there has been a very interesting session, and just to continue with the engagement and with the cross-cutting collaboration, the European Commission is going to organize an international conference in November this year, so that we can continue this discussion and really try to solidify and crystallize some specific actions moving forward into a global sentinel system. So that was it from my side. Thank you.
Okay, thank you, Alan. It's now time to close, I think. Okay. Thank you very much for your participation to this side event. It's a really a milestone for all of us, for the the spread of the wastewater surveillance studies globally. Okay, thank you for our panelists, and thank you, my colleague Bernd Galvik.
Thank you for being allowed me to say you have seen today an amazing amount of intelligence, of work, and really dedication. I hope you have noticed that we almost had gender balance. We were almost 40% men. I strongly believe, I'm convinced in saying that this would not have been possible if we had not had this balance. So I think this is also very good and nice closing of this event. Water is a very precious issue. There's a lot of things to be done. We need every brain, and we cannot leave anybody behind. And if it's female-led, well, you see, we can go very far. Thank you very much for being here. And a special applause to Bilge for being here.
Can we take a photo together? Can we take a photo together? Yes, please. I can stay here because I'm short.
Dear participants, we have some coffee and tea downstairs and complimentary bags for you. Thank you again for coming.